A good candidate for a penile implant is any patient who's just not satisfied with the current methods that he's using to obtain an erection and is looking for a more reliable way to get an erection whenever he wants. Generally speaking, most insurances do cover the procedure. So in the United States, the most common penile implants that are available are either a malleable device or the 3-piece inflatable device. A malleable implant is a pair of flexible rods that are placed into the corporal bodies of the penis. So basically what that means is men can just simply bend their penis up when they want to have an erection in intercourse, or bend it down when they're finished. An inflatable implant is a more natural erection. So this is a 3-piece device with cylinders that are placed inside of the penis. So when a man wants an erection, he can pump it up, and when he's done, he can deflate it. So it's much more natural appearing and feeling for him. So penile implants are all custom made in the sense that during the procedure, we measure the length of the penis, both inside the body and what you see outside. And it helps us make a decision about what size to place. Our goal is to always put in, the correct size to give you the longest, hardest erection that we can. To operate a penile implant is pretty simple. There's a pump inside of the scrotum that the man pushes when he wants an erection, and it causes fluid to transfer from the reservoir into the penis where the cylinders are. At the completion of intercourse, he simply pushes the release valve, which is also hidden in the scrotum just above the pump, and it transfers the fluid back into the reservoir. So in this way, fluid's never lost and it never needs to be replaced. Fortunately, the neural pathways that are involved with erection, ejaculation, and sensation are separate. So after a penile implant is placed, ejaculation and orgasm are exactly the same. The implant is completely concealed. I like to tell men that, you won't look any different than any other guy at the gym. No one will ever know that you had this done. The implant is made of Bioflex, which is a flexible and very strong material. The solution inside of the implant is sterile saline, and it does not ever need to be replaced. The procedure to place a penile implant is pretty straightforward. A small opening in the scrotum is made, and the whole device is placed through that. So we recommend that you take at least a week off of work after surgery and about 2 to 3 weeks off from lifting anything heavy. But everyone is different, and again, most men are feeling pretty good after about a week. So we have men wait about 4 to 6 weeks before using their implant. Most penile implants are still functioning at least 20 years. Penile implants actually have the highest satisfaction rate compared to any other treatments for erectile dysfunction. So roughly 90 to 93% of men and their partners are satisfied after surgery. So overall, penile implant surgery is very safe, but it's important for men to understand and know the more uncommon risks associated with this sort of surgery. So things like infection, bleeding, bruising, or change in sensation.